I'm very proud of what Jefferson has done to make a commitment to population health. It was not popular, and we opened the doors to our college in September 2009, so now almost 14 years ago, and I was dean for the first 11 years of that time. Now I'm back on the faculty doing my own work, and part of that work was to write how COVID crashed the system, along with my colleague Charles Wolforth, who is a science writer in Princeton, New Jersey, not far from Philadelphia. So what is our book about? It's a very fascinating, important, and maybe vexing story. The analogy we made was that the U.S. healthcare system was an airplane, and COVID made it crash. You know, there was amazing heroism and amazing commitment to work. But the real story is not what happened at the bedside. The real story is the greater picture of how Brazil's society and our society had some important failures. And that's really what the book is all about.
And I think we have a lot of similarities in the sense that we have a lot of inequities, and we don't really have a lot of information about it in Brazil. So we were discussing this yesterday, how employers should be aware of the difficulties their employees are suffering. We should collect data on social determinants of health, because many times this is a better way to change the health of the population than doing other initiatives, right?
Absolutely. I think in America, the term social determinants of health, certainly our college and many other organizations made this a more popular term, but let's remember, even 5 years ago, no one was really talking about the social determinants. And what COVID pointed out, like shining a bright spotlight on this problem, that if you are poor, you are at greater risk. And of course, it turned out in Philadelphia and across all of America, disproportionate, terrible outcomes, more deaths in populations of color, most especially in America, Black population, Latino population, multi-generational houses, lack of health insurance. And the question is, what did we learn? Yes. And can we improve and do a better job? We have a lot to learn, and I'm like to think of myself as an agitator for change, that if we just keep doing the same thing we did before COVID, well, we're not going to improve anything. Exactly. So we need a new model of care, and we need better primary care. We need better connection to the community, and we are working on each of these areas, but it's not a switch that you could throw and all of a sudden it's fixed. It's going to take time to change some very old habits.
Yes, I agree. And in Brazil, although we have this public healthcare system that covers 100% of the population, those that have private insurance, that it's around 26% of the population, don't usually use the public system.
Sure.
And in the private system, we have similar problems to what you described in the book in terms of lack of coordination of care, overutilization. We don't have the culture of using primary care before going to a specialist.
Right.
And I'd like to talk a little bit about this, but also start thinking about the solutions you proposed as well.
Great. Well, as I said, the first half of the book is very sad. You know, 1 million dead, that's more casualties than all of the wars America has fought since the Revolutionary War. So what are some of the solutions? Look, I think tackling poverty and reaching into the community. So you can't have value without improving equity and reducing disparity. So this now needs to become one of our top jobs. I think the second thing that we talk about, and certainly because this is MIT, is leadership, right? So how are we going to train the doctor, nurse, pharmacist, and administrator of the future so she'll be better prepared to tackle a problem like a pandemic. So that means they need to understand what you're an expert in, the social determinants, the economic impact, improving access. So I think the second potential solution is leadership training that's focused on these issues. I think a third area is change the economic incentives. I'm excited to be here today to talk about that at the broader forum. And when we say that, at least in America, we mean align the incentive so we're focused on what others have called the true north, meaning what is the real business that we're in? And I believe the business we're in is to improve health. However, if you look at the evidence, we have failed to improve health in America for sure.
So it's a big honor to be here, as I told
Pleasure.
you. Very good. Thank you for the conversation we had today.
Great to be together.
It's always inspiring. Thank you.
Thank you again.